Antonis Kousoulis. I'm Director of England and Wales at the Mental Health Foundation, and I am going to talk to you about our mental health in the pandemic study. The Mental Health Foundation is a UK-wide charity. We're over 70 years old, and we have a vision for a world with good mental health for all. Our mission is to help people understand, protect, and sustain their mental health. And taking a public mental health approach and really focusing on prevention is at the heart of what we do as an organization. Since mid-March 2020, we have been leading the mental health in the pandemic study. It is an ongoing UK-wide long-term study of how the pandemic is affecting people's mental health in the UK as a whole, but also locally and across the 4 nations. We have been working on this study with the University of Cambridge, Swansea University, University of Strathclyde, and Queen's University Belfast. Since the start, and that was before the first lockdown, we have done regular repeated surveys of representative UK samples of more than 4,000 adults each time. More recently, we have also surveyed adolescents and young people in school and get their views as well. It is not a diagnostic survey that we are administering, rather we are taking a public mental health approach. Each time we cover a range of topics designed to shed light on people's emotional responses to the pandemic, the key social drivers of distress, coping mechanisms and resilience, as well as suicidal thoughts, and how these are changing over time since before the first lockdown through different lockdown measures all the way to the summer and beyond. And we are going to keep running the study for about a whole year. Our study has been instrumental in raising the profile of mental health in the times of the pandemic. We have shared our data and our research with various colleagues across the mental health sector, but also beyond. Our research has been featured in various media. We have been sharing our data with the UK government across the 4 nations. We've been sharing information with public health teams, with mental health teams, Department of Health, Department of Culture, Media and Sport, as well as other departments. Our research has helped inform some of the recovery plans, some of the measures. We were one of the charities with this research that really highlighted how key the issue of loneliness has been in impacting people's well-being since the start of lockdown measures, and how this has changed over time. And we have also shown how issues like suicidal thoughts, addictive behaviors, resilience have changed over time. Our research has also highlighted which are the groups that are most at risk for their mental health to be impacted since March, and we have helped prioritize and show which population groups should be targeted with additional measures because they have been experiencing higher inequalities and vulnerabilities since the start of the pandemic. We are a partner in the Closing the Gap network. We are working very closely with our colleagues at York University and looking into the issue of people with existing mental health problems and also the physical health of people with existing mental health problems. Our study has some really useful findings. We have seen that people who entered the pandemic with a prior experience of a mental health problem have been more likely to experience anxiety, hopelessness, and distress during the pandemic. During lockdown, that's mostly the first lockdown, but also more recently, we have seen that many of the supports for people with mental health problems, such as one-to-one therapy, training courses, volunteering, supported employment opportunities, were curtailed or stopped. Particularly peer support and community resources that relied on meeting in a physical space have had to adapt or pause their provision, resulting in the loss of or reduction in support for many people. Our mental health in the pandemic study have shown that those with a pre-existing mental health problem have been the most likely to experience stress or report an inability to cope with that stress of the pandemic. And really worryingly, they have reported suicidal thoughts and feelings at a rate almost triple those in the general population. So we can see that the health of people with existing serious mental illness is really at risk at this time. Our study further supports the view that has been expressed by the Closing the Gap Network as well, that the pandemic has hit the mental health and well-being of people with long-term disabling physical health conditions particularly hard. We did find that in our various waves of research, a higher proportion of people with long-term disabling health conditions reported having difficulty coping compared to the overall population. They were also more likely to have been worried that the pandemic may make their existing mental health condition worse. And people with physical health problems and a pre-existing mental health condition were more likely to be more anxious, panicked, afraid and lonely. So the pandemic has brought really a perfect storm for people with serious mental illness and has made it really difficult to look after their own mental health. To find out more and to read some of our recommendations about what can be done and should be done both now and in the mid and longer term to support this population, you can visit our website. Thank you.